Good morning, everybody. It's 11 minutes past 8 o'clock right now. Welcome back to the program. And we have a friend joining us in studio, Jackie.
Yes, we do. Dr. Mollie James joining us with ReBalance because we need a little balance in our life this morning.
Right?
And I know I do. And we're heading into a time where we're still continuing to think about our health and different ways we can do to improve ourselves. And there's something that's been floating around that I think people want more information on, and it's called Coolsculpting. And this is something you offer in your office, correct?
It is, yes. And it's interesting because we get a ton of questions about it. And so this is a great opportunity to kind of dispel some of the myths.
Okay.
I remember several years ago when it first came out, I was just out of medical school and I saw it on Inside Edition.
Oh, no.
And I said, there's no way that works.
So what's the premise?
Yeah, remind everybody what it's all about.
Yeah, so basically with Coolsculpting, what they have done is they've taken a way to freeze fat, and it kills the fat cells and reduces fat. So basically, it can be used for shaping and sculpting the body.
So that's why it's called Coolsculpting.
Coolsculpting. Now, does it hurt?
There's not really. There's a little bit of discomfort when we put the applicators on, but other than that, it's pretty pain-free. It's completely non-invasive, so you can do it right in the office. You can leave our office and go to yoga or go run, so there's no downtime at all.
So it freezes the fat, and you have to realize that fat doesn't freeze real easily. So how cold are we getting this?
Yeah, so basically what they found, this all came because kids were sucking on popsicles, and so they were losing the fat in their cheeks. So doctors started to study that, and they harnessed that technology.
Really?
So what they found is the fat freezes at a higher temperature than all of the surrounding tissues. So it freezes before the skin or the blood vessels or the nerves.
Really?
So what we do is we do a controlled freeze to that temperature. So that way it crystallizes and kills the fat cells, leaves all the other cells around it just fine and intact.
No kidding.
Yeah, and then the body just clears that out by a process called apoptosis, which is how our body gets rid of all of the dead cells.
Unbelievable. Okay, so we have some video that we're going to show you to kind of give you an idea of the process and what would it be like if a patient was coming in to visit you at ReBalance Clinic and Medspa.
Yeah, so in this situation, this is a consultation. So what we do is we look at the areas of concern and we pinch the fat so that it mimics the applicators. And what you're seeing there is a template for the applicators. So we actually plan this out and kind of mimic what the results would be right in the office so patients can see what they would expect. So you can see here each circle that's there corresponds with a treatment area.
Okay.
And is there a minimum that you want to freeze like this, or a maximum?
There isn't. So that's what we get a lot of questions over the phone. How much does it cost? You know, can you tell me about it? And every person is so different with their goals and their body to start out with. We really have to see them in the office so that we can determine, number one, are they a candidate? And number two, how many cycles do they need?
Now, that's the applicator that's doing the work, correct?
Correct. So that's I'm applying the applicator to the abdomen.
Okay, and how long does it stay on there then?
The treatments vary. So we have the latest technology. So what you're seeing there is the Cool Advantage. That's a 35-minute treatment. The outer, we can do outer thighs as well. So that one's a little bit longer at 75 minutes.
Okay.
Yeah, so it kind of varies in that range.
Okay, so what do you do for 75 minutes when the applicator is attached?
Great question. Yeah. So in our office, we have Netflix. We have Hulu, so you can sit and watch a movie, you know, hop on the Wi-Fi, check your email. I have people doing work while they're there. I have people who choose to read,
so really,
relax.
You mentioned it was pain-free. It really is not going to interfere with what you're doing normally then?
Not at all.
Wow.
Now, a lot of people, I'm sure, are having concerns when you consider freezing something, especially when you see the skin. Obviously, it's going to get a little red when you're thinking of cold application on the skin, but you're not causing any like freezer burn or anything?
Doesn't. So back in the picture, we saw those white pads that went on before the applicator. So those white pads actually have product in it that protects the skin. It's kind of like antifreeze. And that it's a fabric that protects the skin. So we do things to prevent that.
But you said that they learned that the fat cells freeze quicker than the skin does. So you're not even getting close to freezing the skin, are you? Yeah, so you're just targeting those fat cells. I never knew this. That is really neat.
Yeah.
How you can do that.
Yep. So they've advanced even since we started this over 2 years ago, about 2.5 years ago. We had the initial applicators, and they've even advanced the technology since then. We were the first in town to have the latest Cool Advantage, which is less painful because it's a shallower cup and they've changed the technology. So
it continues to advance.
It continues to advance.
And obviously people are using this and enjoying it. What are the results, or what are you hearing feedback-wise? Because we saw kind of the before there in the process, but how soon are we going to be able to see results so that we get what you're kind of showing us in that evaluation?
Perfect question. So generally it takes 8 weeks to start seeing results, and then they peak at about 12 weeks. So that's one of the things is people get a little frustrated because about 4 to 6 weeks in, you're thinking, you know, I should be seeing something. And some people start to see that.
Right.
But again, we're not going to see that maximized until about 8 to 12 weeks.
All right, so how many times am I coming in to have this done then?
So again, it depends. So some patients can come in for one round, one session. A lot of times we do a second session just because of the goals that we have. So
it's a matter of freezing the fat cells and then just waiting for your body to eliminate the dead cells.
Yep.
That sounds so simple.
And it's a really gradual process, which is good because if it did that quickly, it could cause organ damage. So it's a very slow process, which again, we want results now. That's why that results in 8 to 12 weeks, because the body's just slowly cleaning up those cells and getting rid of them.
But you're not being invasive by surgery or anything like that.
No surgery, no anesthesia, no incisions to heal, no infection risk. So it's far superior to some of those other things. It's a little different outcome as well. You know, they're different things. But for somebody who really doesn't want to have an operation and just needs some slight sculpting, it's a great option.
Now, are there specific areas, like I know we were showing stomach, which I know ladies we like, and even guys like to make sure that gets a little more thin. Where else are people using this, or where are some places we can?
Great question. So the abdomen and flanks are probably the most common things that we see that we need attention to. The chin, the double chin.
You can do the chin.
Yep, we can do the chin. Arms is huge right now. And Coolsculpting just got an indication for some skin laxity as well. So it tightens the skin up just a little bit.
I was wondering about that. So if you're removing the fat cells from there, the skin's going to be a little loose in that area. Now, does it have a tendency to tighten up a little bit too?
A little bit,
Okay.
it does. And we have our own protocol at ReBalance where we combine that with some other treatments to maximize the skin tightness along with the Coolsculpting. So we have a different procedure in the office that we do afterwards. So the step 1 is the freeze, and it looks like a frozen stick of butter. And then step 2 is doing a massage after that to get those fat cells deepened and expanded into the tissues.
So you make sure to take care of everybody, but beyond,
and we do that with that extra device.
That kind of massager to kind of get everything back to shape.
This sounds fascinating.
It is,
But one of the things with ReBalance is that you don't just have someone comes into the procedure. It's like, okay, thanks, hope you work out with that. It's like you really work to make sure everybody is going forward in a very healthy way. So you can cover more things besides just sculpting. If they need help with other things to really change their lifestyle, you provide all those services.
We do. So one of the things Coolsculpting does not do is weight loss. And so a lot of the people who are coming in for Coolsculpting are interested in that or would love to see that. So there are the things we do. We offer all of our patients an eating plan that they can follow. It's anti-inflammatory, kind of gets back to the good nutrition part.
Right.
And then we follow them, so they come in for pictures, so before and after pictures, because again, this is kind of subtle sometimes. But when you see the dramatic pictures, because they're seeing it every day, so it's not dramatic.
Right.
But when you see that 90 days after in a photograph, they're like, wow, I didn't realize,
absolutely,
how much difference it is. So
that is absolutely amazing.
We can treat anything. If you can squeeze it, we can freeze it. Is kind of the motto. So,
yeah.
Okay.
What's the most dramatic results that you've witnessed since you started doing this?
Probably the belly treatments.
Okay.
So.
And how much of a belly have you been able to eliminate? Your most extreme one that you know?
Yeah, it's hard to tell in words. It was just a very dramatic before and after picture.
Do you have those available for people to look at if they come
I do,
over?
yeah.
Okay.
When we do our consultations, we go through our before and after gallery and kind of show people what to expect with the number of treatments that we've discussed.
And just find out whether or not this is for them.
Correct.
That's the whole idea.
Correct.
Right.
I was going to say, so how do we start that process to see if this is perfect for us?
So we offer a complimentary consult. We are so excited to teach people about this. It's been in Iowa for a while, but people are still just learning about it, haven't heard of it before. So complimentary consultation, come in, we outline what the options are, get going from there.
That works.
And we have financing, so for anybody who's worried about the cost of it, right in our office, you get on the iPad, you register or apply for financing. Within 2 minutes, we have a decision, and we can get you going.
Wonderful. And also, people probably don't realize there's been advancements to this technology since it was first announced years ago. So it has only gotten better.
It's only gotten better.
Since it was
They
first
continue to
announced.
study it. Millions of treatments have been done, so you know it's working well, or there wouldn't be that many people coming back. And some of the biggest business is people who've had it and have a good outcome, and they're like, now I want the next body area.
Right.
Right.
So,
Okay. All right. So
yeah.
let's tell everybody how they can find you. I think
Yep.
that's the people are going. Okay, where is this place?
Where is it?
Yeah.
Yeah, we're at 5901 West Town Parkway, so we're right down the street from you guys.
Absolutely.
Our number's 515-257-8150. You can just give us a call, and like I said, it's a complimentary consultation. There's no pressure. You know, just come learn about it, see if you're a candidate, and know your options.
That's
Perfect.
awesome.
Thank you, Dr. Mollie, for joining us this morning.
Thank you.
All right.